Hi, everyone. I'm Vassy Kapelos, and this is the Power and Politics podcast for Tuesday, February 2nd. On our pod today, the feds have struck a deal to make millions of COVID-19 vaccines on home soil, planning to produce millions of shots at a Montreal plant with Novavax. That's a vaccine manufacturer. But it looks like the doses won't come off the production line until the end of the year. Industry Minister François-Philippe Champagne is here to talk about that. And then NDP leader Jagmeet Singh will respond. Plus, Peel Region's Dr. Lawrence Lowe says virus variants are a big concern. He'll join us later on to discuss. And then the Power panel will debate how exemptions for new travel restrictions could work. First, though, here's my conversation with François-Philippe Champagne. Hi, Minister Champagne. Good to see you as always. Thank you for making time for our program.
Thanks for inviting me. It's always a pleasure.
Minister, can I start off by asking you to be extremely specific on the timeline for when production of vaccines will begin? Because the Prime Minister implied it would be closer to the summer. You said later that it would be closer to the end of the year. Will there be vaccines for Canadians produced in this facility this year?
So let me be very concrete and very specific. So there's three phases: construction, certification, and production. Construction of the facility, we expect to finish around the end of the summer. Then we have a certification, which is what we call the best manufacturing practices. This is governed by Health Canada. This is for any biomanufacturing facilities in Canada. And once that certification is done, then you can move to production. That's why I said by the end of the year, because the period in between, the certification could be anything from a few weeks to a few months. But the good thing is that the big news today is that Novavax has chosen Canada to produce their vaccine. I spoke to the CEO. They could have gone in 7 or 8 other countries. They're producing in about 7 others around the world, and they chose Canada. And that, for me, is a very positive sign, because in addition, let's be clear as well, we have contracts for securing Novavax vaccine if they are approved. And now we're adding a domestic, made in Canada, by Canadian, for Canadian vaccine, so that we make sure we are resilient for the future, whatever may come.
Yeah, but the key there, I think, that I'm hoping you can expand on is the future, right? This isn't something that's going to help with our current issues with vaccines. This is something that will help at the very earliest towards the end of this year. Why wasn't something like this, some deal like this, the facility itself, why wasn't it done earlier?
What we've done, I mean, if you look, the World Health Organization declared the pandemic, March 11? And on March 23rd, the Prime Minister already announced significant investment. You have Medicago in Quebec City. We invested about $170 million. You have Vido in Saskatchewan, where we made significant investment. You have Abcelera in Vancouver. This is yet another pillar to ensure our resiliency. And I would say, Vassy, anyone who's been in the business of building plants would tell you that normally it would take 2-3 years to do that. But this is like an Apollo project. We've been pushing them. We've been working with them, investing capital. And in the case of Novavax, through our discussion and the work that has been done over months, we were able to attract them in Canada to build the pillar of resiliency that I think your viewers expect from a responsible government. This is that.
Yeah, sorry, pardon me.
Ahead.
No, finished. My apologies. I was just going to say that you're right that it does normally take 2 to 3 years. But I look, for example, to the UK, where they also announced investments in April, and they already have some vaccines manufactured there, and they'll be able to vaccinate even more people beginning this summer with their main facility. So they were able to get a production facility up and running prior to any timeline that your government has been able to do.
But we didn't start from the same base. When the pandemic started, we scouted the market in Canada with experts and leading scientists, and we didn't have the same scale in terms of manufacturing capability than the United Kingdom. That's why they are where they are today. But what we did when we saw that was really to make early investments to make sure that we would have different producers across Canada. Now, this time we bring Novavax, which in my view is a very good news, because you have one of the leading manufacturer of vaccine, which obviously has applied to be certified in Canada. And at the same time, we're continuing to have discussions with different partners around the world to build the resiliency, to make sure that whatever may come, we will be better prepared. And what I'm trying to bring is all the supply chain in Canada as much as possible to make sure that whatever may come, we are prepared and we can take care of the health and safety of Canadians. But when I hear comparison between Canada and the UK, you have to look that, pharmaceutical companies have been exiting Canada since, it started in the 1980s, different governments, different policies, different supply chain. So we started from a low base, but the investment we've made, I call that, strategic, immediate action with a long-term vision to have a very robust biomanufacturing capability in Canada in a couple of months. And that, I think, for Canadian is good news, because that's really what you want to protect your, to think that it's going to be made in Canada by Canadian for Canadian.
Respectfully, though, Minister, it's not in a few months. It's at least, most of the rest of this year before we see that production capability here domestically. And also, everything I read about the UK was that they were actually very incapable 11 months ago of producing vaccines to the scale that they're about to produce them domestically. And just on the point of you and your ministry and your government looking at all aspects of the supply chain, again, I'd have to challenge you there, because the Globe and Mail reported, for example, that your government decided to go with the NRC facility and invest in that as a production facility versus Nuvax or other private options. Did you really put the attention to this at the time that your government should have?
Yeah, and if you go back to the UK, I just want to say, Vassy, we started with a different base. I know that they were in a similar position, but in terms of scale, they started with a higher base than ours, and that's why they are where they are and we are where we are. When you look at different manufacturers, we've been investing in different companies. The one you mentioned, we rely on advice from experts and leading minds in the countries who know about manufacturing, about technology, about the type of innovation. And we took their advice when it comes to where should we invest. And when they were looking at that, there was an issue about scale and speed, because there's been a lot of Canadian companies with great innovation, and I want them to succeed. We all want them to succeed. But when they were looking at that, where we could do our investment to have, the maximum impact in the shortest amount of time, this is what was driving in terms of having scale. Because when you're looking at Royal Mount, you're talking about 2 million doses a month. That's significant. But we're going to continue to invest. We're going to continue to work with anyone in the country who may have, therapeutics or vaccine to ensure that we are resilient for the future.
So you're saying the decision to go solely with the NRC facilities was because of advice the government received? I just want to make sure I'm clear on that, because there were also a lot of stumbling blocks with that investment, right? This was supposed to be up and running prior to when it's actually going to be up and running.
Well, there's two parts as well. When you look at the NRC, you have the clinical trials part, and you have the manufacturing line, the one that we're going to be using with Novavax. And when you're looking, it's not just the NRC, by the way. Medicago in Quebec City, we invested $173 million to build a state-of-the-art facility. If you look at Vido in Saskatchewan, the same thing. Upcetera, you're
those are all, again, a year out, minimum.
Well, I mean, it's because there's just even if you're doing an Apollo project, Vassy, anyone who's been doing in manufacturing, and I did, would tell you that to build a plant and a biomanufacturing plant, that requires a number of months. There's things you can compress, and I'm really impressed from what I've seen. Some of them are really doing work that is extraordinary. And then you have the certification, because on one end, Canadians want that to be quick, and I'm one of them. But at the same time, you want to make sure that all the safety protocol are respected. That's why I said there's always three phases: construction, certification, and production. And these companies are doing as quickly as they can. And we will continue to work with them to make the investment necessary to protect people.
And I'm certainly not taking away from the process that they have to undergo. I understand that scaling up is a big issue. But you know the questions that the government is facing right now about depending on a supply solely from other countries. And the question that's being asked of your government is, did you do everything possible to get to the point where there might be deals struck like the one you did today, and instead of a year from now being able to manufacture vaccines for this country and for Canadians, it could have been done a lot sooner? Can you honestly tell Canadians that you exhausted every option, including privately run labs?
Well, if you look, pandemic was declared on the 11th of March, and the 23rd of March, we were already investing. This is going to be close to, it's almost a year since we have invested. But as you said, Vassy, it takes time to build these plants. Despite the best effort of all these partners around the world and in Canada working, a year ago, we made the investment. And the Royal Mount is quite extraordinary that we're able to do that in months. I was talking to the CEO of Novavax, that's quite extraordinary. That then in a matter of months, we will be able to produce 2 million doses per month. Usually they'd say, Minister, that would take years to build. But I think with focus, with strategic investment that were done almost a year ago, because the Medicago, like I mentioned, the Vito in Saskatchewan, the Epcenter in Vancouver, those were done a year ago in terms of investment.
I get all that, but none of that stuff is going to help people right now.
Well, I think, one thing that Canadians want is that we have two streams. One is the vaccine procurement, and there the Prime Minister has been clear, everyone will be vaccinated by September. And what we're doing now is about resiliency. I mean, we have to do both at the same time. Once you want to make sure, and we have a program to vaccinate people now, but at the same time, when you look at variants and when you're looking ahead, I'm sure that the viewers are looking and say, I hope my government is making the strategic investments so that we will be best prepared. Whatever may come next, whatever is the next health emergencies in months, we will be there. And we're trying to accelerate that as much as one can and with the best experts that we can find. And today, having Novavax chose Canada, to me, that's a sign of confidence that people can take away and say, we have one of the leading manufacturers who's willing to come in Canada and produce in Canada.
Okay, Minister, I'm out of time. I'll leave it there. I do appreciate your time, though. Thank you.
It's always a pleasure. Thanks for inviting me.
That's the Minister of Industry, François-Philippe Champagne. Let's take a look at how Canada compares to other countries right now in the race to vaccinate. Israel remains ahead of the pack, with 57% of its population receiving at least the first dose. Most G7 nations are also administering injections at a faster pace than Canada. The United Kingdom is vaccinating its population at more than 4 times the rate of this country. The U.S., Italy, and Germany also outpace Canada, where 2.6% of the population has received at least one dose at this point. An update now on the fallout from Julie Payette's resignation as Governor General. Rideau Hall has received a formal harassment complaint. It comes after a scathing review of the work environment under Payette's leadership. CBC's Ashley Burke, of course, is with us for the latest on this. Hi, Ashley. What can you tell us about the actual formal complaint?
Well, Vassy, this is the first complaint that is in writing with someone's name attached, the allegations laid out, that's in the office's hands in connection to Julie Payette's mandate. Before that, through sources, we knew that including former employees, that there was over the years informal complaints. So conversations that workers had with HR, with the ombudsman, with their union reps, with managers raising concerns about alleged mistreatment on the job in connection to Julie Payette and her second in command, Assunta De Lorenzo. However, they argue action wasn't taken. People at that time told us they were too scared to put their name down and raise concerns in writing because they felt it was their word against one of the most powerful people in the country. There was a culture of mistrust and fear that people did not trust the system, that action would be taken. So now there is this formal complaint. It came out of a workplace review that was done. The report led to Julie Payette's resignation, this external review. The redacted version of the report last week, we were on your show talking about it. It claimed that there were allegations of a toxic workplace. Some described it as that there was a reign of terror there, that a climate of fear. It talked about how there was allegations of yelling and screaming, mistreating employees. We now know in that report as well, there was a line that said there was a formal complaint, but that it fell outside of the jurisdiction of the review. That's now been passed on to the Privy Council office. It's looked at it and passed it on to Rideau Hall. It was received yesterday for them to start looking into. Rideau Hall, for its part, is not releasing details about this complaint. We don't know who filed it, who it was about, what the allegations are. They're saying that that is all confidential, but that they will thoroughly investigate this and follow their procedures in place when it comes to their workplace harassment policies.
And just quickly before I let you go, do we know anything about any of the changes that are set or have already taken place, like the government promised would happen at Rideau Hall?
Well, one of the biggest changes is that the Prime Minister has appointed a new secretary. So the second in command at Rideau Hall, which replaced Assunta De Lorenzo, who was Madame Payette's longtime friend. She was a former lawyer, so she didn't have experience in the public service. And they've gone back and kind of returned to normal. They've appointed Ian McCowan in this role. He is a longtime public servant. He worked with the Privy Council office as a deputy secretary to the federal cabinet. His first day was yesterday. He had a town hall with employees, and part of his job is is going to be working to restore a healthy workplace at Rideau Hall. The clerk of the Privy Council has also been tasked with heavily getting involved in this as well. That report found that the PCO needed to act swiftly and immediately to take decisive action. So he's going to be speaking to staff too coming up.
Okay, thanks, Ashley. Appreciate the update. As always, the CBC's Ashley Burke. There's growing concern among public health officials about the spread of new variants of the coronavirus. Even though the number of new infections across the country is declining overall, public health officials are urging Canadians not to let their guard down.
I think there are definitely signs that the variants are at least transmitted to a certain extent in community, and we probably are not detecting them all. Because some of the cases in individual provinces haven't been linked back to travel. So this is the initial signal that we need to be very vigilant and very cautious about those relaxation of public health measures.
At least 135 cases of the variant first reported in the UK have been found in Canada, and at least 13 cases of the variant first reported in South Africa have been detected here. One of those cases was diagnosed in Peel region yesterday. Dr. Lawrence Lowe is Peel's medical officer of health. He joins us now. Hi, Dr. Lowe. Good to see you. Thank you for making the time.
Thanks for having me.
My understanding is this case is an adult male living in Mississauga and had not traveled. How big of a worry is that to you?
Well, certainly it's, we've conducted extensive case and contact management on the case since. We've interviewed dozens of people in connection to the identified B1351 variant that was picked up in Mississauga. Still have not found a link to travel, as you heard in Dr. Tam's initial comments just prior to my interview, which really speaks to the fact that it may be circulating in our community, which means that any increase in contacts or loosening of restrictions may lead to an erasure of the gains that we've seen in the last few weeks.
And what is the primary concern with these variants? Is it that they're more contagious?
Absolutely. So in general, both the B117 lineage, which was first detected in the United Kingdom, and this B1351 strain that have been identified, the concern is that they could be up to 50% more transmissible than the original strain of coronavirus. And so the concern being that if we were to reopen too quickly and increase contacts too quickly, you could see spread happen more widely and more quickly within the community, essentially setting us back to where we were just before the holidays.
The modeling that the province shared last week did show that these newer variants would likely take over as the dominant variants by, let's say, in the next 2 months. Does that sound does that make sense to you? And are you expecting that in your region?
I think it's to be anticipated, especially since these variants are more easily transmitted and more easily spread. We are still having a certain number of interactions that are occurring, especially in the region of Peel, where we have a large essential workforce that hasn't really been impacted by the stay-at-home order in place so far. So barring any additional support for those workers, which is absolutely needed in terms of paid sick days, in terms of more proactive workplace inspections, in terms of rapid testing in workplaces, the reality is that any transmission more and more, now that we know these variants are in the community, will likely be one of these variants of concern.
I have to ask you about paid sick days because I remember the last time you were on the program, and this was weeks ago, you were talking about it, Dr. Eileen Davila was talking about it. There seems to be a bit of a back and forth between the province and the feds about how changes to the program going forward might work, but it still hasn't happened. Are you frustrated?
Well, I think for me, it's more just speaking to the data and evidence. There is a lot of evidence out there that paid sick days is a economic way to keep businesses open rather than the alternative of shutting them down when an outbreak occurs. And that it's also a way to really give essential workers some peace of mind so that they can do the right thing and stay home and stop spread. The reality is you can increase testing, you can increase isolation housing, but people aren't going to use it if they can't take time off work and if they need to make sure that they keep food on the table. So the data and evidence is pretty clear. If you want to fix the essential worker challenge that we have in Peel, you need to support them with paid sick days.
And when you speak of an essential worker challenge, how much of a proportion of the spread of the virus is what's happening in those essential workplaces?
Absolutely. We see almost 40% of our outbreaks in three sectors, which is essentially manufacturing, warehousing and distributing, and also food processing. We continue to see, especially with the recent outbreak at Canada Post, that these essential workers are working in jobs that they cannot do from home, where they may have challenges maintaining precautions if volumes are high. And even if precautions are completely followed, sometimes this disease is so insidious that it still manages to get a foothold.
And so beyond sick days, which of course are a big part of the solution, as you and other public health officials have described, I've read, for example, that you're suggesting perhaps considering not allowing non-essential goods to be shipped, like ordering a TV online. Should there be other things that the province is considering when it comes to those workplaces?
Well, like I said, I think paid sick days are a much more economical and feasible way to address the challenge. But to the extent that it's meant to really drive home the point for all of us who have the benefit of working from home, who have the chance to meet behind Zoom screens, every package that shows up on your doorstep is ultimately put there by someone. And even now, just as we're trying to get transmission down just temporarily for the next few weeks, I think that the suggestion was, is there something non-essential that you're maybe ordering online that you could probably defer until rates are better, maybe in the spring.
And so given what you're seeing right now with the spread of the virus, the situation in essential workplaces and the possibility of variants, do you anticipate that the measures that are in place right now for Peel region will remain there for a while?
It's interesting because I think the measures that have been put in place really helped to quell the holiday surge that we were seeing, and especially reducing a lot of the discretionary activities that were occurring. But if you take a look at Peel's numbers, we've essentially been in a plateau for 8 or 9 weeks, only really starting to see a decline just in the last 2 weeks. And ultimately, if you really want to address some of the transmission patterns you're seeing in the community, we need to support our essential workers in Peel.
Okay, Dr. Lowe, I'll leave it there. I appreciate you making the time very much.
Thanks so much.
Dr. Lawrence Lowe is a medical officer of health for the region of Peel. The Power Panel is here to weigh in on that. With me right now, Elliot Hughes, Françoise Blavin, Shakir Chambers, and Jason Markusoff. Jason, I'll start with you because I interviewed Minister Champagne, and we'll hear more of that a little bit later about that. And he was pretty definitive that he did not feel the criticism was valid, that he was defending the government's actions so far. He said they did survey their options and that we just couldn't kind of scale up to the same degree the UK has over the same period because they started at a different base. What do you make of the government's answers to those criticisms around the speed at which this has happened?
I mean, it's fair to say that we weren't going to be as effective as, manufacturing powerhouses like Belgium, the US, or the UK, in the same way that it's not really fair to compare us to Israel, a country that offered to pay far more for vaccines than their people and offered their country's health data, which we don't have, for Pfizer's great use. But it is fair to say that this government has not been has not been working as fast as many people would have expected them to work on getting this vaccine domestic supply going. This government is proving really, really good at solving down the road problems on vaccination. They keep boasting, they heard again today from Ms. Anand, that they have the biggest portfolio, the most vaccines, but that has little to do with what the current concerns are of Canadians as we watch many other countries in the OECD get vaccinated at much higher rates. Our peers in the US, that vaccines are going out to pharmacies now for widespread use. Clearly this is the government wanting to put some good news in the window at this point when people are anxious about what's happening today. But it will only remind people that things are not going well today, and maybe down the road things will be better.
And Shakir, it is difficult to get much transparency around the process by which all this happened. By that, I mean the Globe and Mail has done some really extensive reporting, for example, on some of the private options that the government bypassed and instead focused on this facility, this government-run lab, versus a private one that was right next door. The minister addressed it to a degree, but didn't specifically say why they had ruled that out. It's hard to kind of find out information about what options were before the government in order to kind of objectively assess whether or not they did, in fact, maybe put their eggs in the wrong basket. What do you think?
Yeah, I would agree with that assessment. And I think that's kind of what I was saying earlier. To me, I always hear the Prime Minister come out and say, we'll spare no penny in our fight against COVID. We'll ensure people have the supports they need. And obviously procuring vaccines and manufacturing vaccines is key to kind of getting over COVID. My issue becomes when it comes to this domestic manufacturing or partnering with these private companies, I don't think they spared any penny, right? I think they actually chose the winners they wanted to have, put their eggs in the basket of the NCR, for example, allowed it to have this long-term future manufacturing capacity, which doesn't solve today's problems. Instead of saying, you know what, we'll focus on the NCR, we'll make sure we have this year out from now, we'll be able to manufacture for booster shots or whatever. But some of these companies that are coming to us and saying, we can get this done in the next few months, we can have these online by late 2020. Why didn't we put eggs in those baskets and at least roll the dice in that area? And to me, that's where I think it's contrary to what the government was saying about not willing to spare any penny, because I don't see them putting those millions of dollars towards those companies that have put those claims forward as far as having the vaccine online very soon.
It's interesting, Elliot. I mean, you have experience, lots of experience behind the scenes in government. I don't. But some of the people we've spoken to who run those private enterprises said they felt there was almost like a hesitancy to bet on something that was so risky. Do you think that is a function of government or of this government in particular, or governments more widely? And could that be possibly the case here?
Yeah, you took the sentiment right out of my head, Vassy, to be honest. I mean, I really think there's a sense of lack of entrepreneurial spirit here in Canada. And I think that sort of goes across, government in general, and not with this government, but the past few governments. And I think it's an underlying challenge that we have as a country, frankly, when it comes to this, but also, innovation policy and other pieces where we seem reluctant to take risks and want to take risks. And I think Shakir makes a good point. I would say that there are trade-offs when you want to get risky, and so you need to weigh those carefully. But I think you're right. There is a reluctance in Canada to be a little bit more adventurous, to have that entrepreneurship, that entrepreneurial spirit, whereby perhaps that would allow us to partner with certain companies. For example, in the UK, the person, I believe, in charge of the vaccine is a venture capitalist. Yeah. They took some risks. They made some bets in different places, and that paid off. The European Union put their vaccine rollout and their vaccine purchases in the hands of a trade negotiator, and they find themselves behind the eight ball. I think we're in a similar situation there, and so that entrepreneurial spirit, that risk tolerance, I think needs to increase. And this is something that I think is going to be important in the budget as well. I know that's not really on topic, but as the government begins to think about how we're going to build economic growth, we need to have that built into our thinking.
Whenever that budget happens, now you got me excited. Francoise, let's talk about only a nerd like me would be excited by the mention of a budget. Francoise, let's talk about the politics of this a bit, because I think you hit on it a little bit earlier. I keep asking myself, just given all this uncertainty right now, and I'm not laying blame in this statement at all, but given the uncertainty, to continually keep hearing the government every day come out and say, we're going to hit that September target, we're going to hit that June target, should they be, it's a question I've been asking myself, should they be couching it a bit more? Do you think they have to keep saying that because of public pressure? What is your sentiment there?
Well, I do think that they're hoping that not the nerds, us, but that the general public, it gets into their brain, and that's their electorate, and that's what they're hoping sinks in. But it's quite the gamble, in a sense that a lot of things has to fall into places, and it goes back a bit to what the guys were talking about. Elliot mentioned the lack of entrepreneurship in this country. I would say it's the lack of entrepreneurship sense from the government, who depends way much more on globalization and thought that its salvation would come from outside our country, and that it could depend on otherwise allies during the course of the last 10 years or so. And dependent on them. And now they realize that they're just buy-ins. They couldn't rely on the states at the time of the one I refuse to name. and they look to Europe, who's trying to shut their frontier, saying, hey, we'll serve ourselves first, and realize that great global unity is not really there when it comes down to the pandemic in each country. So now they have to get a bit more entrepreneurship, all things that we used to have, that governments after governments let go and prefer to think that other countries could do it for us, and that's it. But no, that's the sad reality. So I'm sure they're crossing their fingers, hoping that we get our deal, fair deal with Pfizer and Moderna, because most of it depends on those two companies. And that's the only way that Prime Minister Trudeau mantra will work. But boy, he's going to pay a price if he waits that long to go into an election if it doesn't come.
Since the beginning of this pandemic, there have been stories of funerals that haven't been able to be held, weddings had to put off or done by Zoom. Even if we do look at, or the minister does look at specific exceptions for compassionate, exceptional cases, I can tell you that our focus on making sure we're keeping Canadians safe from importations of this virus and of new variants is going to remain steadfast.
The government has moved to discourage Canadians from heading south for March break, including imposing a new mandatory hotel quarantine at a cost of $2,000 per traveler when they return home. But what about Canadians who can't afford to pay? How will this government determine who gets an exemption? The Power Panel is here with me to talk about that for one last round. Elliot, Françoise, Shakir, and Jason. Shakir, I'll start with you. I think the question of exceptions is an important one, and I think probably clarity is going to have to come sooner rather than later. But overall, politically, I feel like the pressure was on the Prime Minister to make a move like this, and it sounds like he recognizes that. He's not about to sort of back down from the overall measure.
Yeah, I think even if you look at public polling, they overwhelmingly support stronger travel measures. So I think the win is in the sails if you look at the Liberal government. I just think the intention of what they want to do is the right intention. Listen, you want to discourage COVID from coming into this country, but I think the actual policy itself right now is a little incoherent, whether it's having these exemptions for people who have to go abroad for compassionate reasons, whether it's the inconsistency between how those who fly into Canada versus those who drive into Canada are treated. I think that becomes a big issue. Can we have a coherent policy? Can we have consistent treatment of people across the board? And then again, to the earlier point you made, for those that need to go abroad for what we can term essential reasons, is there going to be that carve out? And let's remember, I think it was during Christmas time, there was an MP or two that had to visit a family member for a funeral or an essential reason, and they lost their committee position or their cabinet post for these similar things. So, I mean, if you look back at that and you have to say they were treated this way for going abroad for what we're going to deem essential moving forward, I'm not so sure the appetite is there to have this carve out for anybody going abroad to just go to a funeral or go to whatever it may be moving forward.
Yeah, it's interesting in those cases, Jason. I mean, most of them lost their portfolios or, let's say, committee roles in those cases, in the specific cases I think that Shakir is referring to. But also that I noticed the whips of the parties said at the time, well, they didn't notify us ahead. They hadn't let us know. So it was they didn't seem to be condemning their actions to the degree like the politicians who had gone away on vacation to Hawaii. But because they hadn't been upfront about it, there was a consequence for what they were doing. I imagine it's not going to be necessarily that easy to draw a line in the sand, though, when it comes to who's exempt, who isn't. What do you think, Jason?
No, it is. I mean, this is where, there's probably been a lot of conversations with airlines in the last several weeks as they've been shuttering routes from Mexico and the Caribbean. Airlines have long had policies with compassionate carve-outs and exemptions and discounts and allotments for people. So perhaps the government can talk with them about how they do it and figure that out. It's obviously very new, unusual, confusing territory for the government. I think back to how long it took the government back in last spring to actually close the border with the U.S., close the land border, get that in place, and how complicated that was when things were new. In dealing with closing some of these loopholes that we talk about in travel, limiting things. So you're just talking about the compassionate carve-outs and allowances. That's going to take time with this Biden administration. They're just working on their own restrictions, their own situations, that they put in after Trump for so long refused to put in them, that this will be sort of the secondary thing for them. I think that the warnings themselves, the cautions, are going to do a fair bit to limit the risk of people traveling for non-essential purposes, and keeping a firm hand and limited hand on how many exceptions you will hopefully do the same.
Yeah, the message seems to be out, at least if I think to conversations that I have with people who are not involved in this show, Francoise. There's a lot of people saying, oh, wait, now I guess I can't travel. And I was like, well, actually, they've been saying it for a while. But it seems like it's at least more specific right now. That said, it feels like there needs to be some meat on the bone pretty soon for people to, I guess, really modify their behaviors.
Yes, and in some aspects, sometimes it's better to have a rule that might seem pretty harsh, and then you have all the bleeding heart saying, oh, well, this is a good exception, this is that, and you just don't get the end of it. I was looking at the Léger Marketing survey today on this morning on Quebec Premier. François Legault is at 80% acceptance of the work he's been doing. He imposed a curfew, which I've never lived in my whole life. A curfew, never thought I'd live that in Canada. And people agree with all the strong measure. I'm looking forward to see how much they agree with them for opening a bit more the province. So and saying that there will be a March break, and what will people do with those type of message? I remember when I was a kid, my parents would say, hey, we give you an inch, you take a foot. And sometimes that's what we have a feeling of what we're living. What we do not want to live or relive on this magnificent Groundhog Day is the same thing we lived last year. So I think people agree that they can be a bit harsh on certain measures when we realize that some people find exceptions in pretty much everything. Not to say that there are not some cases that shouldn't be pleaded to the right officials, but when I saw the stats that your researchers sent us today, I really fell down my chair, knowing how many exemptions were given. I think it was like 70-some%.
I'll give the quick, I'll interrupt for a second. From March 31st, 2020 to January 24th, 2021, more than 8 million travelers came to Canada, of which 8.6 million, let's say, of which 74% of them were exempt from quarantine by virtue of meeting an exemption. And the exemption is laid out within an order in council, so that there are specifics, but 74, I was pretty surprised by that number too, 74%.
So that's what you get when you give some exceptions. So I don't know when we'll get out of this anyway.
Elliot, what do you think? Final word to you.
Well, I would say that 50% of those were truck drivers. So that is keeping the trade going, which is key. Look, this is not an easy issue for the Prime Minister, but I do think it's the right one. Whenever you make a sweeping change like this, and this is a pretty tough sweeping change, there are always going to be exceptions, and there's always going to be difficult circumstances, and you got to deal with those as they come. But this is the right move.
Yeah, just quickly, I'll say Léger poll, the Léger poll that you're referring to said 86% agree with stricter measures that suspend flights to most sun destinations and require quarantining at a hotel. 87% think the government should go even further by banning international travel until there are several consecutive days of reduced COVID-19 numbers. So, Elliot, like all of you have been saying, this is definitely going further is not something that you're going to get public backlash for at this point, it seems.
No, I don't think you're going to be punished. I think it's going to be something that's seen as, smart. And looking back, it was probably an attitude that the government should have taken, as was mentioned earlier, last year when we were dealing with this. And so hopefully they see that benefit now.
As you guys mentioned, March break of last year feels like 20 years ago when I think about it. Okay, thanks to our power panel tonight. Great discussion. Really appreciate it. Elliot Hughes, Françoise Boivin, Shakir Chambers, and Jason Markusoff.
Two companies, Precision Nanosystems and Novavax, are now on track to manufacture vaccines right here in Canada. This is a major step forward to get vaccines made in Canada for Canadians.
Welcome back to Power and Politics. The federal government announced a plan today, as you heard there, to produce millions of COVID-19 shots at a plant in Montreal. A deal was secured with Novavax, whose vaccine was submitted to Health Canada for regulatory approval last week. The facility, though, won't be churning out doses until the end of this year. Jagmeet Singh is the leader of the NDP. He joins us from here in Ottawa for some reaction. Hi, Mr. Singh. Good to see you. Thank you for making the time.
Thank you, Ms. Kapelos.
In your comments immediately following the announcement, you said there's no reason why the Prime Minister should not have negotiated the ability to produce both the Pfizer and Moderna vaccines in this country. But the technology behind those vaccines was extremely untested. We had never developed a vaccine like that before in this country. Was it not prudent to kind of wait a little bit to see if it might actually work?
Well, what we know is that we are right now faced with a lot of uncertainty. And the uncertainty with the supply means people are worried, and they're not, and it erodes public trust. So it is vital that we have supply, that we get everyone vaccinated. And the fact that this is not negotiated in the first place in Canada is deeply concerning. We see that the supply chain issues from Europe, questions about whether we're going to receive enough vaccine, all of this could have been dealt with if we had negotiated the ability to produce it here in Canada.
But that's not necessarily true, because it's one thing to negotiate with the companies, and I take your point on that, to ensure that those vaccines can be manufactured domestically. But you have to have the facilities to be able to do that, and we won't for a little while now. So it's not as though it's just a make a deal and all of a sudden the vaccines can be produced here.
First off, we knew that vaccines were going to be a key issue a year ago. And so the preparation to be able to produce vaccines should have been the first issue that this Liberal government tackled. Right away, we knew that the light at the end of the tunnel of this pandemic was a vaccine. That was something immediately that we knew about. So why didn't Justin Trudeau take the steps necessary at the beginning of this pandemic immediately to secure the potential ability to produce the vaccine in Canada? Why don't we know about whether or not this was negotiated at all in the first place? The contracts are not made public. Other countries have done so. Other countries have provided full transparency around what was in the contracts. I don't know why Justin Trudeau didn't provide that level of clarity to Canadians, specifically when we all knew that the vaccines were the vital key to ending the pandemic.
Well, other countries, you're right, have made their contracts more publicly available, but they still remove all commercially sensitive information. I've looked through them. There's a lot of redactions. Are you okay, for example, if the government put out their contracts but redacted the same type of information?
Well, we should have some transparency. The fact that the Liberal government hasn't provided anything is problematic. And we also want to know why wasn't, or was there a reason, or was it even negotiated to be able to produce the other vaccines in Canada? We can't just assume that we didn't have the capacity. We don't even know if that was negotiated and what was in that negotiation, if there were steps we could have taken to be able to produce it here in Canada. We know for certain, Ms. Kapelos, that the lack of ability to produce the vaccine in Canada has meant that Canadians have not received vaccines. And we know that not receiving vaccines means more people will get sick and more people will die.
I take your point on manufacturing vaccines at home, but where the contracts are concerned, is it understandable to you? I mean, I've asked the question of the government. The point that they've put forth is that it might undermine their negotiating position, right? To put all that information out there, to lay out the things that you're talking about, for example, about what was negotiated and what wasn't. Is that position understandable to you?
Well, if other countries have done it, I don't understand why they can't disclose it. It's very normal to say, well, we negotiated for this or for that. If there's anything that's very sensitive, it can be redacted, of course. But the idea that the government can't let Canadians know what was negotiated does not make sense, does not hold water. Other countries have disclosed, so people know what's going on. The more we can tell Canadians about what the plan is, what's been negotiated, how we hope to achieve the goal of getting everyone vaccinated, that's just going to increase public trust, and people need to know what's going on so that we can encourage people to take the vaccine, to trust the public health advice. Without transparency, the public trust gets eroded.
I want to ask you as well about the proposition that your party has been putting forth when it comes to manufacturing vaccines, and it is that sort of a public body be responsible for it, that you take private corporations out of it. What evidence can you provide Canadians that would actually be a more effective solution to producing vaccines?
Well, we've known that it's worked in the past. In fact, in Canada, we owned a public corporation, a publicly owned entity, Crown Corporation, Connaught Labs. And it was established because at the time there was a diphtheria outbreak and the vaccines were too expensive. We started producing at home. The history of Connaught Labs is we were able to produce things like insulin, make world-leading advances, and we were able to have some of the most affordable the prices when it comes to things like insulin and access to critical drugs, which are chronically a shortage issue here in Canada. So what we're proposing is, given what we've seen being at the mercy of large pharmaceutical companies and their logistics, if we were able to produce it here in Canada with a publicly owned company where we can control the manufacture of critical drugs and of vaccines, it would put us in a better position. It would allow us to have that sovereignty, that ability to produce life-saving vaccines and critical drugs for Canadians without having to worry about the logistics that we're seeing now that are holding up issues with vaccine delivery.
In a vacuum, I understand the argument being put forth, but that company that you referred to, the endeavor here in Canada to do so, that was sold back in 1986. It ended. The world has changed so much. Tufts Center for the Study of Drug Development says the average cost of bringing a medicine from invention to pharmacy shelves is now $2.7 billion. The rate of success of developing a new medicine has fallen to just 12%. Private companies can take that on in this world. Can you envision a public endeavor that could compete with that?
Oh, absolutely. If you look at what's happened in this case, there's been massive amounts of public money that have been poured into private companies that then make the innovation and then turn around and sell it to the public. So absolutely, we should make the investment. In fact, the savings that we would enjoy in the ability to keep people safe, just saving lives, the ability to continue to work if we had our own vaccine delivery and we delivered across country, the impact on our economy, it would more than pay for itself. It is vital that we are able to produce our own vaccines, our own critical medication. It will absolutely pay for itself and actually put us in a much better position as a country economically and in the well-being of the population.
But take, for example, some of the Canadian endeavors that have been largely publicly funded when it comes to developing a vaccine. They're far behind the private companies that were able to do so in record time.
Well, what we've seen with this vaccine development is very different. Money has been poured in from the public sector. Money has been poured in privately as well. But there's been a massive kind of global effort where everyone's been focused on this, something of the likes of which we've not seen in generations. The idea of everyone working towards a goal. The ability to produce this vaccine in our country, to develop it in our country, would be vitally important. We would not be at the mercy of these large pharmaceutical companies. The capacity to produce critical drugs would also help the well-being of Canadians in general. We know that this has worked in the past. It can absolutely work now. In fact, more than ever, we're seeing drug companies increase the price of medication year over year, gouging Canadians, gouging people. We need to be able to have control of that, and producing it ourselves would be a vital step towards having that sovereignty, that ability to protect ourselves.
Yeah, and I'm not taking away from, I think a lot of Canadians will hear that and understand, it'd be nice not to be in the position we're in right now. But I think of the outfits in this country right now that are producing their own vaccines, some of which have just entered human clinical trials. They are months behind the other vaccines like Pfizer, like Moderna, like AstraZeneca, like Johnson & Johnson, all of which are backed by big private companies, but which have been able to develop product at a faster rate than those that are publicly funded. So will what you're proposing address the issues we face right now, or is this something that might aid us 10 years from now?
Well, certainly the fact that these big companies have produced it hasn't helped Canadians right now. Right now, we're still without access to vaccines. We're still without the ability.
We have access to vaccines.
Well, let's think about it effectively. Effectively, do we have all the vulnerable people in Canada access to vaccines? Are all the seniors in long-term care vaccinated? Are the frontline workers vaccinated? Do we have enough vaccine to even vaccinate all the frontline workers?
No, you're right, but we don't have no
most vulnerable people. So it doesn't matter if a company has produced it if it's not actually in the arms of people. And that's really what's critical here. At the end of the day, the Liberals talk a lot about announcements of vaccines, maybe production in the future. If we're not getting vaccines into people's arms, if people aren't getting vaccinated, people aren't safe. We aren't saving lives. And that's why it's so critical that we talk about how we get people vaccinated And the fact that if we could have produced this here in Canada, would have been far better in the beginning.
I totally understand your point on the speed. I'm just saying it's not like there's no vaccines. I get what you're saying. Not everybody who needs it is vaccinated, though. I take your point. I'll leave it there. Thank you, Mr. Singh. I appreciate your time as always.
Thanks so much.
That does it for us today. Make sure you subscribe to our pod so you don't miss any of the latest political news. If you like this episode, we would really appreciate it if you shared it with a friend. Thanks for listening.
For more CBC podcasts, go to cbc.ca/podcasts/podcasts/podcasts/podcasts/podcasts/podcasts/podcasts/podcasts.